Imagine a community teetering on the brink of losing access to crucial healthcare services due to federal budget cuts. That's exactly what Santa Clara County faces, and they've taken a bold step to address it. On August 7, 2025, the Santa Clara County Board of Supervisors convened a special meeting to consider placing a sales tax measure on the November 4th ballot. This move aims to safeguard the public hospital system from collapsing under the weight of impending federal spending reductions. The Board of Supervisors voted unanimously to include this proposed sales tax increase on the ballot, alongside a vote to select a new county assessor to replace Larry Stone, who recently resigned. This decision was made just hours before the deadline to submit ballot measures to the county election officials. County leaders expressed their commitment to establishing an oversight committee to ensure that the funds collected are used responsibly. Supervisor Sylvia Arenas emphasized the importance of transparency, stating, "It would be great to receive updates on a regular basis, monthly or quarterly, to build trust within our community." The draft proposal outlines that the tax would be in effect until April 1, 2031, generating approximately $330 million annually. Experts estimate that this amount will only cover about one-third of the $1.4 billion in projected losses by 2030 to Northern California's largest public hospital system. These losses stem primarily from federal cuts to Medicaid, known as Medi-Cal in California, which accounts for the majority of the county's health system revenue. Additionally, the county will face significant reductions in federal food assistance funding. Santa Clara County operates 2 of the region's 3 trauma centers and the sole regional burn center in the Bay Area. These hospitals are vital healthcare providers for the working class and uninsured population, serving nearly 1 in 4 of the county's 2 million residents. Community health advocates welcome the proposed tax measure, recognizing the urgent need to protect essential healthcare services. Dan Nelson, the chair of Valley Medical Center's Emergency Medicine Department, highlighted the strain on the current system, noting that his department often operates at over 207% capacity, with occasional surges exceeding 500%. He warned that federal cuts could push the system into a full-blown crisis. However, taxpayer advocates have raised concerns about the potential regressivity of the sales tax, arguing that it would disproportionately impact lower-income residents. This ballot measure comes amidst a series of tax-related controversies in Silicon Valley. Earlier this year, the Silicon Valley Taxpayers Association filed a lawsuit against Campbell over a previously approved half-cent sales tax increase. Additionally, discussions about a separate sales tax to fund public transit left local transit agency leaders scrambling in May. Former Saratoga Mayor Stan Bogosian criticized the timing of the Board of Supervisors meeting, questioning why such an important matter was addressed during typical working hours. He suggested that future decisions affecting tax revenues should be scheduled at times when residents can actively participate. Supervisor Betty Duong underscored the long-term implications of these changes, emphasizing the need for the county to reduce its dependency on federal funds to ensure that its values remain intact. As the election approaches, the community will have to weigh the benefits of maintaining essential healthcare services against the financial burden of the proposed sales tax increase. This is a pivotal moment for Santa Clara County, and the outcome of the November ballot measure will shape the future of healthcare access in the region. Will voters support the tax increase to safeguard public hospitals, or will they resist the added cost? The decision lies in their hands.